Hello. This presentation was created by Lindsay Dahl, an internal medicine physician fellowship-trained geriatrician. Today, we're going to talk about one of the 4 M's of geriatrics: mobility and fall risk assessment. Mobility, fall risk assessment, and management is a very important M in the 4 M's. Why is it important? Falls are common. The older you get, the more likely you are to experience a fall. They're the most common events that threaten independence in older adults. It's what makes people move from independent living to assisted living, or from assisted living into nursing homes. 1 in 3 adults greater than the age of 65 report falling each year. It's something that's often underreported or not reported for fear of losing independence. 50% of those greater than 80 years old have reported a fall in the last year. Obviously, that makes sense. The older we are, the more likely we are to have frailty and other chronic medical diseases that put us at risk for falling. Thus, the more likely we are to fall. That holds true in studies. Complications of falls leads to death from injury, and that's another reason it's very important. We have a polling question today to test your knowledge. What is the reported annual fall rate among adults aged 65 and older? A. 1 in 10. B. 1 in 3. C. 1 in 2. Or D. 1 in 5. The correct answer is B. 1 in 3. The majority of falls result in some injury. If it's not a fracture, it could be subdural or intracranial hemorrhages. It can be large hematomas and bruising. There is a significant death rate attributed to falls, and that increases with age. The highest mortality is noted in men aged greater than 85, with 180 deaths per 100,000 population. One of the biggest things is also fear of falling. We know that fear of falling causes isolation in the older adult. The more isolated the older adult, the more depression, cognitive decline, dementia, and increased risk for falls from not moving and having an expanded socialization. If we fall and we become fearful of falling again, then we kind of isolate ourselves. We don't do the activities that we used to do, and in turn, we become more likely to fall. It's a vicious cycle. It's very important that we are always on the lookout, asking our older adults if they have fallen in the last year or had any near misses. It's important that we start to do some evaluations in our clinics. That gives us an indication that somebody's at risk for falling, so that we can catch people before they fall, which can prevent the downflow of all the events that happen. Falls are associated with a decline in functional status, assisted living, or nursing home placement. There's an increased use of medical services and the fear of falling. Cost is huge. If there's a downward flow of more falls, more isolation, more depression, there's more dementia and more functional decline. It's a vicious cycle, and we need to intervene at some point so we can turn it around. There's also the risk of the person who falls and lies there 24 or 48 hours before somebody realizes that they haven't heard from them and checks on them. Then we deal with a more significant hospitalization that often results in rhabdomyolysis, kidney failure, and so on. The cost of falling is huge for our medical facilities. Increased emergency department visits increase hospitalization and increase cost to the healthcare system. We take for granted walking. In our younger agile selves, we don't think about it at all. But it is really a very complex process that involves many systems. It involves the brain, especially the higher-level brain functioning of motor planning and processing speed. It involves the vestibular system, knowing where your head and body are in space. It requires input from vision and the other senses, peripheral neuropaths, and peripheral nervous function. It requires muscle strength, muscle flexibility, and the joints to be in line and strong. It requires you to have a good functioning cardiovascular system, as well as a lung system. All these things are working together to keep us up on our feet. Normally, if we have good vision and proprioception, we can see that if the ground is uneven, that we have to step up higher because there's a crack in the sidewalk. If we hit it slightly with our toe, Then we're able to quickly get the nerve impulse relayed back to our brain that sends out a very fast motor planning to adjust that step and catch ourselves before we fall. All those things slow down as we get older. Our vision is not as good. Our hearing is not as acute. We have weakened muscles, decreased proprioception, and decreased muscle strength. We're on multiple medications that can affect all of these things together. Walking is such a complex thing that we take for granted, and we do it without thinking, but it's a very complex process. Besides the intrinsic things going on in our own bodies to help with our walking and staying on our feet, we have environmental or extrinsic factors that affect falling. The biggest one is medications. Always look to medications because those are likely to be contributing to the risk for falling. Obviously, shoes. Sometimes a sweet older woman comes into the clinic who is unsteady on her feet at baseline, but wants to look good for the office visit, and so has a 1-inch heel. There's also people who are declining in their flexibility who want the slip-on shoes, and so they have the slip-on shoes that don't have a heel. Those become a problem, because without a shoe that is covering your heel, you have to change the mechanics of your walking. You have to squeeze your toes, which then makes you have to have a higher step to clear those toes through your stride. Shoes are a big deal. The environment around you is also a big deal, such as an uneven sidewalk or a hill that you are walking down with a pothole or a little hole in your grass. Does the patient have clutter? Do they have rugs? Do they have a threshold? Do they have poor lighting? What kind of bathtub do they have? Is that going to cause you a problem for falling? All these things and many more that I haven't mentioned can contribute to falling, even wind outside. I've had an older adult who fell over because of the wind here in Fargo one time. Ice here plays a huge role in our stability, and for any age. It certainly becomes more of an issue the older we get. All those environmental extrinsic factors are important to consider as well. There are certainly many medications that have been attributed to falling in older adults, such as the anticholinergics. The medications that cause blurred vision, dry mouth, and constipation can affect our balance and our stability. The biggest one that we run into all the time is Benadryl. Somebody takes a Tylenol PM that has diphenhydramine or Benadryl in it, and then they're falling. This would include any other kind of first-generation antihistamines. For hypoglycemic agents, insulin is the #1 cause of older adult falls in the emergency department. We have to check on their blood sugar. Are they getting hypoglycemic and then falling down? Are we over-treating their blood pressure or the congestive heart failure? Our algorithms for heart failure have us ramping up the ACE inhibitors, diuretics, and beta blockers. With that, are we causing orthostasis so that they have no blood pressure when they stand up? That's contributing to falling. Antipsychotics are big ones, and we seem to be prescribing these more and more when we really should be limiting them in our older adult. Cyrocalquishapine has been used for sleep so much in the hospital. The patient gets discharged on a small dose for sleep, and we forget to take it off. Those people are more likely to fall. Even SSRIs have been shown to increase your risk for falling the older we get. Other things that are sedatives, like muscle relaxants. Some of the medications for the prostate can contribute. All the alpha-blocking agents and benzodiazepines, for example, the lorazepams, Ativan, and Xanax. Those kinds of medications have a very high risk for falling in the older adult. Medications are huge, even ones that you don't think of as being dangerous or on the Beers List criteria. Inappropriate drugs for older adults can become dangerous, especially if they're causing low blood sugars, low blood pressures, or low pulse rates. We need to watch out for those things, especially if somebody reports when you find out in their history that they had recent adjustments and medications changes. You need to ask about what are they taking over the counter, because they feel like those medications are not dangerous, but they certainly can be some of the most dangerous things they have taken. Benadryl is a good example. In studies, it's even been shown that it doesn't matter. The total number of medications increases your risk for falling. Even if you're on medications that are thought to be very safe in the older adult, the more that you have to take each day can increase your risk for falling. It's important to do a good review of medications in somebody who presents to you with falls, because it's most likely something that is contributing.